Hi, my name is Dr. Joe Sheppard from Sheppard Chiropractic. We're going to talk a little bit about upper cervical chiropractic care and the benefits that you can receive by having these type of adjustments. The upper neck bone is the master connection between the brain and the body. The two upper vertebrae, called the atlas and the axis, when they are misaligned, they cause dysfunction in the system. These two vertebrae, as you can see, one of them shaped like this, okay, and the second vertebra is shaped like this. When they're out of alignment, the upper neck can misalign like this, okay? And the second vertebra can misalign like this. When the upper neck vertebrae are out of alignment, the symptoms can be neck pain, dizziness, blurred vision, double vision, ringing in the ears, and headaches. The two upper neck bones coordinate all functions between the brain and the body. And when they're out of alignment, they can cause major dysfunction in multiple different areas of the system.
My name is Ken. I've been coming here for about 9 months to a year getting adjustments. The ones on my neck have been life-changing. They have improved my clarity of thought. My sleep has greatly improved. I'm a much better person now than I was before I started getting the adjustments. It's something that the VA was not offering. I've had multiple concussions in Iraq, and they weren't really equipped to properly treat that. But if this is something that you're able to do, it's something that I definitely recommend.
Hi, my name is Rebecca Tasco. I am 28 years old and I've been seeing Dr. Sheppard for about, almost 2 years now. I originally started seeing him after a concussion, and then in addition, I fell down a flight of steps when I was 12 years old and have been in and out of physical therapy, back doctors, you name it, and with no resolve and waking up in pain every single day. Since I've been seeing Dr. Sheppard, I can say it is the first time in my life that I can remember what it is like to wake up not in pain. When I come in and get adjusted, not only do I think clearer, but I feel better, and I look forward to it every single week. Dr. Sheppard is a great man, and he always listens and takes great care of me. And I live in Indiana and choose to drive all the way over to Amelia, which is 45 minutes away, to continue to come and see him.
Before I started here, I had a lot of trouble getting up and down. But since I've been here, it's been much better. There are times when I can do it by myself, most of the time by myself. A few times I've had to call my family to come and rescue me, but on the whole, I can do it almost all on my own now. And even fixing meals is a little bit easier now. The biggest problem is if I had to stoop over more than I would normally stoop, I would have a little trouble, like I felt like my knee was going to go out. But it's much better now since I've had these treatments.
Hi, my name is Gary Rooks. I've been coming to Dr. Sheppard for quite a few years. I've been in martial arts for well over 30 years and dealing with all the blunt force trauma and strikes to the body. I've been involved in boxing, kickboxing, mixed martial arts. And over the years, I started noticing that, my balance wasn't as good anymore. Started losing short-term, long-term memory. Balance was not a good issue for me as well. It started really reflecting in work and my lifestyle and everything else with traveling. And when we started doing the upper cervical manipulation or treatment, I started noticing quite a bit of difference coming up. I always had a lot of pressure in my head and pressure in my eyeballs, it was reflecting in my back. My back was always sore very much. My joints would be a major problem. And sometimes it would take 15, 20 minutes just getting out of bed to get loosened up for the day. But I started noticing that I was developing tremors. I had gone and had some medical services done to see what was wrong. I was given the symptom of the blunt force Parkinson's disease. And at that time it really was a major crash for me because I've always been such a very physical person. So it started really having a major effect on what I've done. So when I talked to Dr. Sheppard and we talked about the upper cervical work, I was very interested in having it done because, when you start feeling like you're on the bottom, there's no other way but to climb back up. So after months of having it done, started noticing that my joints were loosening up, my lower back was really significantly better. Upper back, shoulders, I wasn't getting the numbness going down my arms anymore. Actually feeling with my hands and being able to grip started really coming back a lot. Going through the nerve release and stuff like that, the nerve stopped tremoring, I would say, probably after about a month or two of having it done. And the more that I was having it done in a once a month type of issue, it really had started improving a lot. So I don't get the tremors anymore. I'm not on any type of medication for Parkinson's at all. And pretty much just keep up with healthy lifestyle and taking vitamins, and I feel a lot better from it. The pressure has released and left my head. My eyeballs don't have the pressure it did, and my headaches have gone away. So, I really think that anyone who's been in sports or has had car accidents or falls or any type of blunt force trauma would really benefit from this service. And so that's why I'm here to talk to you today. It's really helped me out tremendously, and I would suggest it to anyone to have it done.
I'm Diana Lacey, and I'm 67 years old. In August of 2016, I fell and I hit my head, which in turn caused a concussion. By the 1st of September, I was beginning to have tremors. The shakes started in my left arm first, moved to my right leg, and then the other two limbs. By the 1st of October, I started stuttering, and the stuttering was so bad at times that no one could even understand what I was saying, not even my husband. And around the same time, I started going to doctor after doctor after doctor, trying to figure out what was wrong with me. My primary care physician was sort of stuck. The CT scans and then MRIs didn't show anything wrong. But we finally got an appointment with a neurologist, and he told me that yes, I had had a concussion. It was a mid-level concussion, and that there basically wasn't anything he could do for me. That what had to happen was that my brain had to cure itself. And it could take anywhere from 2 weeks to 2 years. And I was sort of stuck. What am I going to do? I don't want to be this way for the rest of my life. At that time, my son Richard, who had been working with Dr. Joe Sheppard and Gary Brooks on and he started talking to them about my problem. So the first day of January of this year, I had my first appointment with Dr. Joe Sheppard. When I came into the office the first time, I could barely walk, could not hardly talk at all. And between the treatments that Dr. Joe has given me over that period of time is unbelievable. I now am walking very well. I still have some stuttering. Some days it's good, some days it's not. But my overall improvements is it's a dream for me. I've got a number of years to live, and I want to continue them to be able to enjoy my grandchildren and life in general. But I highly recommend Dr. Joe. He worked on my cervical part of my neck and has done so much to get me to where I am in such a short period of time. I've only been here since January, and it's March now. So I've been here 3 months, and I am so glad that I had the opportunity, and my son loved me enough to bring me to Ohio to get all this treatment done.